I would now like to give the floor to Secretary John Andres to report to the Directing Council on the quorum. Thank you, sir.
Gives the floor to the Secretary, myself, to inform the Council regarding the quorum. Rule 5 of the Rules of Procedure reads, "The presence of a majority of members and associate members shall constitute a quorum for the opening of a session of the Council." As there are more than 20 members, which constitutes a quorum for the opening of the Council, I declare there's a quorum. Thank you, Mr. President.
Gracias.
Thank you. I now wish to report that given that Panama was the chair of the previous Directing Council in 2011, Panama will continue to preside over this Directing Council until a new chairman is elected. I wish to welcome everyone and introduce the members of the main table. Dr. Carissa Etienne, Director of the Pan American Sanitary Bureau. Welcome. Dr. Nice Duller, Assistant Secretary of Social Services of the Department of Health and Human Services of the United States. Welcome. Mr. Hector Salazar Sanchez, Manager of the Social Sector of the Inter-American Development Bank. Welcome. Mr. Jose Miguel Insulza, Secretary General of the Organization of American States. Welcome. And Dr. Margaret Chan, Director General of the World Health Organization. Welcome.
Gracias. Quiero concederle el uso de la palabra a nuestra directora.
We now give the floor to Dr. Carissa Etienne, Director of the Pan American Sanitary Bureau, who will offer some welcoming remarks.
Thank you, Mr. President. Honorable President, Excellencies, Ministers of Health, distinguished delegates, distinguished members of the Diplomatic Corps, colleagues, ladies and gentlemen, welcome. I am delighted to welcome you all to this 52nd meeting of PAHO's Directing Council. We come together over the next few days to review the progress and achievements of our region and to plan for challenges and opportunities which our member states face as they seek to ensure the right of all of our people to health. I am honored to share this session with my esteemed colleagues, Dr. Felix Bonilla, the Vice Minister of Health of Panama and President of the Council, Mr. Niels Doller of the Department of Health and Human Services of the United States of America, Mr. Hector Salazar Sanchez, Interim Manager, Social Sector, Inter-American Development Bank, Honorable Jose Miguel Insulza, Secretary General of the Organization of American States, and Dr. Margaret Chan, the Director General of the World Health Organization. As we meet today, we remember the many persons in our countries who have suffered loss of life and continue to experience the aftermath of disaster. We wish to express our solidarity with the people and government of Mexico, with the people and government of Peru, and with the people and government of other Central American countries. We pray that God bless you and keep you. At this time, I would like to take this opportunity to introduce the new Assistant Director of PAHO, Dr. Francisco Becerra Posada. I will ask Dr. to stand so you can recognize. distinguished delegates, the Secretariat has always looked to the guidance of the member states as we especially seek your wisdom at this time when our discussions and deliberations take place against the changing shape of technical cooperation and the backdrop of the ongoing global conversations on the international agenda for sustainable development. How that agenda is defined and which goals are set will direct development priorities and the flow of resources for decades to come, and how those resources flow will affect how the lives of the peoples of our region will be shaped. For PAHO, there is no debate, but that health is a precondition for, as well as an indicator and outcome of sustainable development. Who could argue against the evidence that supports health's role in strong societies, growing economies, stable countries, peace, and security? PAHO's Strategic Plan 2014 to 2019, which you will deliberate on, is responsive to the dictates of health and sustainable human development. Today, the very nature of technical cooperation between member states and regional offices and country offices is evolving, as countries rightfully seek a more prominent role in shaping global and multilateral agendas, whether through regional blocs or as individual member states, while at the same time increasing efforts to meet the health needs of all their citizens. This evolution will require new approaches by us all, at which what I believe is a critical juncture in both national and international development. And so we are looking for support from our partners and friends through forceful advocacy, inclusive dialogue, and joint action. In a world where persistent and recalcitrant inequalities threaten past and future progress. We believe, and I want to quote the words of Dr. Chan, that universal health coverage is the single most powerful social equalizer. Our member states are showing that universal health coverage is not only for the wealthiest countries. They are showing that it is within reach of countries throughout the Americas. Each country will take its own path to advance this goal, but we can all aspire to achieve it. As you can see from your program, we have a full week ahead of us, and I look forward to our discussions and decisions, with reports from the Council's standing committees, as well as updates on WHO reform and its program of work and budget for 2014-2019. We will look at pending resolutions for review and adoption, including those related to the international health regulations, evidence-based policy making for national immunization days, a plan of action for the prevention and control of non-communicable diseases, chronic kidney disease in Central America, and human resources for health, among others. You will be asked to approve PAHO's strategic plan for 2014 to 2019 under the theme Championing Health, Sustainable Development and Equity. I would like to voice my strong support of this resolution on behalf of those who have managed a robust, participatory, consultative process led by the Country Consultative Group, and which included national consultations in over 48 countries and territories. This plan will help to sharply focus PAHO on the pressing task of reducing the inequities in health in the region within and among countries and territories by addressing the social determinants of health and the progressive realization of universal health coverage. You will also receive various progress reports on technical matters. This year, there are more side events scheduled than at any other time in the history of this Council, reflecting the wide range of issues that engage us. Please mark these on your personal schedules. There are some items on your agenda that you must not miss. The official photo of the heads of delegates at lunch today, The reception this evening in honor of the ministers and the PAHO-PAHEF awardees, and the art exhibition to touch your aesthetic selves. And of course, there are the conversations at lunch and over coffee, in the hallways, outside the meeting rooms, on the way back and forth to the hotel, where friendships are made and nurtured, but that I know, where consensus is brokered. We are delighted to have you. Thank you.
Etienne.
Thank you very much, Dr. Etienne. I now wish to give the floor to the Deputy Secretary of the Department of Health and Human Services of the U.S., Mr. Bill Corr. Y para todos, un buen día. Good morning.
Government. Thank you, Dr. Javier Diaz, for that warm introduction and for your leadership as President of the Directing Council. And let me acknowledge World Health Organization Director General Margaret Chan and thank her for her continued commitment to promoting the health and well-being of all people in all nations, and particularly for her warm friendship to all of us. I'm very pleased to be here today with so many distinguished guests as we celebrate this 52nd Directing Council. And I regret that Deputy Secretary Corr was unable to be with us as planned this morning. We have a small matter involving the possible shutdown of the United States government. At midnight tonight, I will be here tomorrow, but maybe not all of us. He and Secretary Sebelius are hard at work dealing with this and with the future of the Affordable Care Act, and I know that you'll understand their absence. PAHO has a remarkable record of accomplishments. It has turned global attention to the importance of immunizations. It's been instrumental in responding to public health emergencies, including H1N1 and the Haiti earthquake. And it has launched a global movement to address non-communicable diseases. All of these advances have been made possible by you, ministers of health, and other country representatives coming together to discuss and make decisions on key issues that impact the health of all people across the Americas. One goal that is particularly essential to health, raised by Dr. Etienne, is a shared priority throughout the Americas, is universal health coverage. Here in the United States, thanks to President Obama's health care law, we're on the cusp of reaching a major milestone in fulfilling that goal. Tomorrow, October 1st, new health insurance marketplaces will open in every state in the country, putting better coverage options and thus better health within reach of millions of United States citizens who previously did not have meaningful access. While some politicians are threatening to shut down the U.S. government at midnight tonight to prevent the Affordable Care Act from coming into full force, President Obama has made it clear that access to affordable, quality health care should be the right of every citizen. On that, I know that all of us in this chamber are indeed united. Of course, each nation has a different approach to healthcare services, cost sharing, financing, and organization. In the past, our nations have worked hard to address the challenges that stand in the way of universal health coverage. We have done so respecting the differences in our societies and in our economies. But we've come together to promote equitable access to essential health services. We've forged evolving partnerships between public and private stakeholders at the local, national, and regional levels. And on behalf of Secretary Sebelius, I pledge to you whatever noise you hear here in Washington over the course of this week, that the United States will continue working with all of you to reduce health disparities and work to tackle the social, economic, and environmental determinants of health. Working together as a region to turn common desires into effective solutions has never been more important, because we have come to recognize that a growing number of the most difficult health challenges we face are not confined within national borders. These challenges include non-communicable diseases, notably cancer, heart disease, chronic lung disease, and diabetes, all driven by common risk factors that include tobacco use, obesity, unhealthy diet, physical inactivity, and harmful use of alcohol. We recognize now the importance of dealing with these challenges in arenas that go well beyond the traditional health sector, and that all these efforts must engage all the countries of the Western Hemisphere in common action. Over the years, PAHO has become a leader on this issue. Later this week, PAHO nations will adopt a regional action plan to address non-communicable diseases. The plan takes into account the need for wide-ranging solutions that tackle the common risk factors I've mentioned and their economic drivers. Successful implementation of this plan will be critical as we do our part to help the global community achieve a 25% drop in premature mortality due to non-communicable diseases by 2025, to which the World Health Assembly has committed all of us. At the same time, we must all work together to prevent, detect, and respond to infectious diseases. In a world where these threats can spread faster and more unpredictably than ever before, building international partnerships and sharing information is critical to improving our national health security. There's no question that we've made tremendous progress since SARS and H1N1. But the emergence of MERS coronavirus and H7N9 just this year should remind us that much more remains to be done. That includes the successful implementation and continued maintenance of the international health regulations. We look forward to building upon the great work that's already been done and continuing to strive towards full compliance with the international health regulations throughout the Americas region. The United States will continue to partner with PAHO to close the remaining gaps. Today, this type of international collaboration is more important than ever, and not just in times of crisis. It is only by working together that we can reach our full capacity to deliver life-saving vaccines and conduct the groundbreaking research that will shape the future of public health around the world. Through our common commitment to universal health coverage, we can better address mental health and the needs of the disabled and gay, lesbian, transgender, and other vulnerable and marginalized people among our citizens. They are, after all, our sisters and our brothers, our daughters and our sons, and they deserve every bit of the same right to health as the rest of us. And PAHO embodies that spirit of cooperative action and commitment to social justice. Today, we have more opportunities to work together to improve health than we ever have before. The United States looks forward to working with PAHO in the spirit of hemispheric solidarity as we continue to seize those opportunities on behalf of all our peoples. Thank you very much.
Thank you, Mr. Dollar. Le concedemos ahora.
We now give the floor to the manager of the social sector of the Inter-American Development Bank, Mr. Héctor Salazar Sanchez.
Muy buenos días, doctora.
Good morning, Dr. Carissa Etienne, Director of the Pan American Sanitary Bureau, distinguished officials, delegates. It is a great honor to be with you once again, as we do every year, the Inter-American Development Bank, and greetings from our President, Luis Alberto Moreno. The current economic scenario is sending clear signs that the region of Latin America and the Caribbean should be ready to continue advancing without the favorable wind that blew its way in the last decade. This less positive outlook calls for a deliberate effort on behalf of all countries to carry out actions in all sectors to move toward consolidation of current achievements, expand and intensify implementation of effective policies, and recognize and address remaining obstacles. In this regard, the health sector substantially contributes in order to sustain and promote a favorable economic outlook for the second decade of the 21st century. There is evidence that attests to the fact that processes of change and the health sector reforms undertaken in Latin America are beginning to bear fruit. For example, the region leads the world in the upward trend in longevity. In the 60s, life expectancy was 56 years, and today Latin Americans can aspire to live at least 17 years longer. Although it is important to work very hard to make sure that this gain in longevity goes hand in hand with better health conditions and quality of life. Currently, 7 out of every 10 older adults suffer from chronic diseases. Also, in the last 2 decades in Latin America and the Caribbean have brought down the infant mortality rate to the lowest level in the developing world and at a faster pace than other regions. Between 1990 and 2010, it dropped from 54 to 23 deaths per 1,000 live births. And even though there's still important gaps among countries, as was the case in 2011, we see that Haiti and Bolivia reported under 5 mortality rates of 87 and 51 deaths per 1,000 births, while the rates for Colombia and Chile are 19 and 8, respectively. Achievements such as these would not have been possible without effective public health interventions such as immunization and oral rehydration therapy, for which the Pan American Health Organization has played a key role in achieving the commitment of political, business, religious, and community sectors, in promoting the leadership of health workers and the support of the media and civil society, and in the implementation of successful joint cooperation mechanisms such as the revolving fund for the purchase of vaccines. Of equal importance is its catalytic role in the introduction of new vaccines such as rotavirus, pneumococcus, and HPV. There's no doubt that PAHO has been in the forefront of the main advances in public health in the Americas, thus contributing to combating diseases, improving equality and the quality and duration of life of its citizens. Even though we began this decade with a healthier region, there's still a long list of pending issues on the agenda, amongst which we find unacceptable levels of health inequality. National averages conceal major differences in health status among geographic regions, levels of income, or indigenous or Afro-descendant populations, and even between urban and rural populations too. An increase in risk factors and an incidence rates of chronic non-communicable diseases, which are now the leading cause of disability and premature death in countries in the region. 3, the persistence of neglected tropical diseases, which have become one of the factors contributing to the poverty traps affecting the most vulnerable populations in our regions. In order to address these remaining challenges, the IDB will support the countries in their commitment to move forward towards universal coverage of health services, promoting comprehensive strengthening of health systems, multi-sectoral work, the focus on social and environmental determinants of health, and promoting innovation and efficiency in the use of financial resources. It is also essential to continue working together with PAHO to provide support to countries in their efforts to implement effective policies, providing high-quality technical assistance as well as through direct financing. The IDB hopes to continue leveraging PAHO's knowledge and experience and to strengthen our partnership in strategic areas such as reproductive health, nutrition, safe childbirth, and integrated management of childhood illnesses through innovative public-private partnerships such as the Salud Mesoamerica 2015 initiative. 2, the Neglected Tropical Diseases Initiative, a partnership among PAHO, the Inter-American Development Bank, and the Sabin Vaccine Institute, which supports projects that go beyond short-term curative measures and include long-term solutions that address the social and environmental determinants of the transmission of these diseases, prevention and management of non-communicable diseases in partnership with PAHO within the context of the Pan American Forum for Action on NCDs. The Pan American Forum for Action on NCDs, health technology assessment, adoption and financing by means of close cooperation between the IDB's network for priority setting and health benefit plans and PAHO's health technology assessment network of the Americas. In our joint work with PAHO, we must ensure that favorable health indicators achieved so far should continue multiplying beyond the year 2020. The objective is not only to do things right now, but to lay the groundwork to ensure that good results will not be an exception, but a constant in the future, thus allowing us to take the social leap forward that millions of Latin Americans deserve. Thank you very much.
Gracias, señor Héctor Salazar.
Thank you, Mr. Hector Salazar. And next, we give the floor to Mr. Jose Miguel Insulza, Secretary General of the Organization of American States.
Dr. Carissa Etienne, Director General of the American Health Organization, Dr. Margaret Chan, Director General of the World Health Organization, distinguished ministers, and members of the Directing Council of the Pan American Health Organization. I want to begin by thanking you very sincerely, Dr. Etienne, for her invitation to be with you at this 52nd meeting of the Directive Council and extend everybody a very warm welcome. Durante casi un siglo,
For almost a century, the OAS and PAHO have worked hand in hand in order to improve the standards of living of citizens in the Americas. This link is even more evident today in acknowledging for some decades now in our countries the close relationship between social determinants as the principles that condition health: poverty, social exclusion, discrimination, inequality, that undermine the basis of legitimacy of democratic governments and at the same time have an impact on the capacity of states in order to design public health policies that are truly effective. Democracy, development, and health are closely interrelated concepts. It is there where we find the importance of cooperation between our organizations as well as in the inter-American system as a whole. The fact that today, in keeping with PAHO's figures, the region is about to attain most of the health goals set in the Millennium Development Goals is due to several factors, but no doubt as part of them, we underscore the coordinated and joint activity carried out by national, regional, and international organizations. I wish to highlight some of these initiatives of cooperation amongst our organizations. Our regional hemispheric consultation on social health determinants, seen from the perspective of civil society, enabled us to bring together more than 3,000 organizations by offering inputs on the impact of economic and social and cultural and environmental determinants of health. The results of this effort are important for PAHO and also for the Inter-American System of Human Rights in its process to reflect upon the observance of a right to health within the framework of the San Salvador Protocol. We've worked together towards the improvement, the treatment, and prevention of HIV/AIDS, an issue on which we have been committed and in keeping with the resolution adopted by the recent declaration of our organization reiterating the will to work with PAHO in order to set 2015 as the Latin American year to protect the human rights of people vulnerable to HIV/AIDS, who live with HIV/AIDS and who are affected by this virus. The major leap taken by our organizations in using the power of information and communication technologies has been essential in order to improve the levels of literacy and the exchange of knowledge, good practices, and experiences on health. We work together along these lines, and I'd like to remind us all that between April and June this year, we organized the first virtual course on the right to health. This initiative was essential in order to acknowledge challenges and common solutions, not only on health policies, but also on legislative processes around this. The network of safe consumption and health, through which we coordinate efforts in consumption and health authorities in order to ensure that goods and services circulating in the market will not endanger health and the life of the citizens of our hemisphere. I believe that it is also important to underscore the role played by both institutions in Haiti. Last week, we held the meeting of the Group of Friends of Haiti as a part of the United Nations General Assembly, an issue at the very core that was the cholera epidemics, which is not only a health emergency, but it tells us about the need for strengthening public institutionality in Haiti. I had the honor of being present and bringing this up at the meeting of a Group of Friends of Haiti, and particularly to express my greetings for the excellent work done by PAHO in this regard. Last but not least, I'd like to underscore and to thank the cooperation offered by PAHO in the development of the report on the problem of drugs in the Americas. The participation of PAHO has been and will continue to be essential since the major conclusion arrived at by that report, and the conclusion accepted generally by all our member states is that the drug problem is essentially a problem of public health, and it is that approach which enables us to overcome the repressive approach that has predominated so far. Drug trafficking, no doubt, represents one of the greatest threats to democracy and stability in the hemisphere. But even if we've made headway in stopping trafficking and production in recent years, it is essential to do much more in order to reduce consumption, which implies bringing at the forefront a public health approach. Upon receiving the mandate to analyze the results of current policies for the drug problem, and in preparing our report before the Presidents of the Americas in dealing with this issue, we had the cooperation of the Pan American Health Organization in order to face this problem with an integrated approach with public health. It is unthinkable that the OAS and PAHO will not support themselves and strengthen their capacities in order to strengthen strengthen the debate that stems from the resolution of our General Assembly adopted in Antigua, Guatemala. Because of that, we attach great importance to the breakfast that we will hold tomorrow in order to hear the views of the distinguished ministers on this issue and on how we can step up our cooperation. The commitment and the active participation of you, Ministers of Health of the region, in launching initiatives within your own countries is essential for this dialogue. We have many progress and achievements to celebrate, but we have areas that have been clearly identified to continue working. Universal access to quality health services. And I take advantage of this opportunity to point out that we understand that this is a major problem that is currently being debated in this country. And in that sense, we express our full solidarity to the effort deployed by President Obama in order to extend health services to all citizens in this country.
La disminución de la
Reducing deaths caused by diseases such as TB, dengue, flu, H1N1, inclusion, non-discrimination of HIV, AIDS population amongst those well-known problems. But we also have the certainty that we are moving forward in dealing with these. I thank once again Dr. Carissa Etienne that has been responsible as director of the Pan American Sanitary Bureau. Yes, 1 year. She's been in this position for 1 year and has shown great ability not only in her technical knowledge but in leadership. And I also thank her for the effort that she deploys so that this Pan American Health Organization will continue having the important impact that it has in promoting policies for social, economic, and political development of our region. Thank you.
Muchas gracias.
Thank you very much, Mr. Insulza. And next, we call on Dr. Margaret Chan, Director General of the World Health Organization.
Mr. President, honorable ministers, distinguished delegates, Dr. Nils Delaire, Mr. Hector Sanchez, Dr. Jose Insulza, my dear sister Carissa, ladies and gentlemen, good morning to all of you. This is my first opportunity to address this regional committee under its new director, Dr. Carissa Etienne. Carissa served previously as the Assistant Director General for Health Systems and Services of WHO in Geneva. I know her qualities very well, and I know you are in good hands. Under her leadership, I'm sure that this region's long-standing commitment to equity, to the values and approaches of primary health care, and to solidarity in health development will continue to grow. The region of the Americas has long led the world in primary health care, and we expect the same leadership as more and more countries around the world at all stages of development make a commitment to universal health coverage. And I'm sure all of you would join me to welcome Dr. Nils Delaire's comment, which he shared with us, about the high political commitment of President Obama to universal health care. This is the one country we look to it for the leadership. If the USA does not address the health inequity in more than 50 million people, we would be very disappointed. But now that the government is taking appropriate action to protect the poorest of the poor, I want to congratulate the government, especially President Obama, for his great leadership. Isn't it true? Universal health coverage is never an easy topic, politically, financially, and technically. But this is, as I always say, one of the most powerful unifying concepts that public health can offer. Equity, solidarity, and justice is the underpinning values of universal health coverage and the right to health of every citizen on this planet. So let me once again thank this region for their leadership. This region has led in many other things well, and I can see a competition in the 6th region of the Big 12. Am I getting into trouble? The more I praise you, the more I get people saying that you are biased. But my bias is based on solid science and evidence. You have made stunning achievements, and you make it possible by the National Immunization Program, and in fact, many other regions learn from PAHO, Emerald, how we mobilize resources, social support, and community support to implement what I call routine immunization, making sure that every child in this planet get access to the antigens they need to protect their health. And of course, now we are talking about other vaccines like HPV. That is also important in protecting women from getting cancer of the cervix. And let's not forget hepatitis B and others that will protect children and men and women from liver problem and liver cancer, and the list is long. As I said, what you have done is tremendous. But going forward, it is important as countries plan for the introduction of new vaccines into the routine immunization service. By integrating economic studies into the decision-making process is very important. You help ensure that the expansion of immunization services is sustainable and that finite resources deliver the maximum health impact. As we have always said, immunization is one of the most cost-effective interventions in public health. The tools and the guidance that you have developed in this region has led you to be, again, the leader to meet the demand from many regions for similar cost-effectiveness study in Africa, Europe, and Eastern Mediterranean. Now, countries in this region, again, you led the charge on NCDs. And I want to thank so many of you in the audience, including my, now I better be careful, my senior brother, not old, Sir George, for your efforts in contributing to the successful political declaration on NCD. As noted in the plan of action, you will be considering the burden of NCDs in the Americas, which is rising. And so many of these suffering or deaths are preventable, so unnecessary. And I had the opportunity and the honor to meet with many countries on Sunday and talk about the importance of NCD control. Without that, we're not going to get there. And the most effective intervention and the best buy is, of course, tobacco control. And I want to pledge WHO's strongest support to you, especially to those countries like Uruguay, others who are under the threat of the big tobacco. You are sued by the big tobacco for taking public health actions to protect your people. I said this many times in public and in private. No country where their leaders are taking the appropriate action to protect people should be stopped and sued for doing the right thing. Do you agree or not? The interesting thing for me was, I thought the big tobacco is only targeting small countries in developing world. No. For your information, the US government is also sued. Norway, Australia, the list is very long. We need to stand up to the big tobacco, and that is our #1 enemy in public health. And I'm struggling very hard to maintain the reputation that has been held by Dr. Brunnen. She was seen as also enemy number one by the big tobacco. So as I said, I need your help to maintain that status. As I said again and again and again, we understand many countries depend on tobacco products as an economic income. We are not here to hurt farmers. We are not here to hurt countries. But we recognize that there is a good process where countries can move step by step gradually to reduce tobacco leaf production, move to alternative crops, those crops that can bring you more income. And I was told by many countries that I have visited that your farmers are not getting a fair deal. So we need to help you, and we will work with you, and we will support you to move and embark on a journey. Doesn't matter how long it takes. You need to show the political leadership that you are doing the appropriate thing to make sure you find the right balance between maintaining your economic growth, but at the same time protecting your people. I'm very passionate every time I talk about tobacco. Now, as countries in this region have demonstrated again the important role of social protection and reduce the level of exclusion, you have done many things to address the social inequalities and the determinants of health, making sure that attacking the root causes, and that is a very smart way to do so. As you build on your experience, you are also taking on a systematic approach to the assessment of the results and the impacts. And the collective lessons learned in this region would give me a big, database and best practices for sharing with other parts of the world. I like to make a special mention of a couple of agenda items for this meeting. I welcome the inclusion of an item on chronic kidney disease in agricultural communities in Central America. This type of kidney disease, which has not been linked to well-established causes, disproportionately affects underprivileged young men engaged in hard agricultural communities. We need to find out exactly what are the reasons for that. And the trend is moving upward, and the trend is alarming. I welcome your deliberation on these puzzling and costly diseases that ends the lives of poor laborers, and that affects the families, the communities, and the countries. What kind of sustainable development are you talking about when your young people are dying from all these causes? And we would pledge our strongest support to work with you to do the kind of research that has been shaped by you and find out exactly what are some of the interventions that we can introduce to reduce the misery and the suffering of the communities. Another important agenda item I would like to mention, this is because what I'm hearing from many countries in this region, is the importance of WHO and PAHO support you to achieve the international health regulations called capacity. And I certainly agree with you. As we are talking, we are nervously watching 3 viruses, H7N9, H5N1, and the MERS-CoV virus, coronavirus. And I have been in touch with countries and talked to them about the need for vigilance, high vigilance as we move into the fall season and winter. And for some reasons unknown to us, in the fall and winter, these activities are increased. So we should not let our guard down. In deliberating on the IHR core capacities, both Carissa and I heard you, and we will do our utmost to mobilize support from development partners in this region and beyond, and to support your capacity building, to make sure that you can meet the core capacities requirement in the timeline as agreed by the World Health Assembly. Friends, colleagues, ladies and gentlemen, you will be addressing many important items in the spirit of solidarity that has given this region its international reputation for leadership. I wish you a most productive session, and thank you.
Gracias, doctora Chan.
Thank you very much, Dr. Chan. Distinguished members of the main table, honorable ministers of health, distinguished delegates, members of the diplomatic corps, and members of associations and organizations. Ladies and gentlemen, I extend fraternal greetings on behalf of the Republic of Panama and its President, Ricardo Martinelli, and our Minister of Health, Dr. Javier Diaz. We recognize that PAHO has given us an opportunity to work with the member states, and I would urge you to continue to confront challenges to health in all of our territories. Before continuing with the day's work, I have some reflections. Health is founded on values, principles, and other elements, some of which I will mention, such as the right to health, social justice, solidarity, citizen participation, equity, intersectoriality, and universal coverage. And all of these protect the entire population in terms of access to health services with prevention, promotion, treatment, recovery, rehabilitation, and palliative care in a framework of a new primary care health system, establishing financial mechanism and protections for the social networks, resources, and coordinating networks in an efficient manner by providing medications, surgery, timely technologies which are effective and safe. What this means is that health systems need to be strengthened by means of a health authority ensuring the right to health, in closing the gaps in health and reducing the out-of-pocket expenditures, as well as increasing surveillance and regulation within our countries. We have worked on a number of relevant issues, and here we refer to the Millennium Goals and the health goals for the region of the Americas. A couple of weeks ago, we held a meeting in Panama on renewed care in order to reduce maternal child death. Now, there's also the framework for tobacco control, a strategy and plan for elimination of mother-to-child HIV and congenital syphilis, a regional plan for the strengthening of vital statistics in health, a plan of action on the consumption of psychoactive drugs and their relation to public health, increasing coverage, improvement of water and sanitation, among others. The consultation with the countries and the countries with their authorities have all contributed to an analysis of regional priorities which are contained in the new strategic plan 2014-2015 with its program and budget, looking at goals which include health determinants as a cross-cutting element in all of its components, and this will allow us to guide our interventions and confront future challenges in the Americas. All of the member countries of PAHO have the capacities which will allow us an exchange of knowledge and experience, and this will lead us into sustained policies for public health so that each country can be more efficient and more effective in finding out what the impacts are. We emphasize the work that's been done by PAHO in approaching the main problems in health in our region. It is a guide in policies that allow us to move towards the construction of a health system by encouraging and supporting local initiatives as well as national and regional initiatives, betting on an exchange of experiences, innovation in science, the development of knowledge and technology in order to improve the capacities and opportunities of health workers in order to provide better health services with an integral view. We continue to strengthen partnerships as part of international cooperation in order to strengthen the relationship among the countries and the relationship with PAHO. And lastly, my thanks to everyone who has supported me. And all of this as part of the great Pan American Health Organization family. Thank you very much. Mr. Secretary, could you please indicate what the regulations are in terms of nominating members to the Credentials Committee?
Of the Rules of Procedure reads, a committee on credentials consisting of 3 members or associate members shall be appointed by the Council at the beginning of the first meeting. This committee shall examine the credentials of the delegates of members and associate members and representatives of observer states and report to the Council thereon without delay. Thank you.
Gracias, señor secretario. Informo al Consejo que en virtud del acuerdo
I now wish to report to the Directing Council that after the meeting of heads of delegation, 3 nominations have been submitted for this committee: Belize, Mexico, and Paraguay. If there are no objections, they are duly elected, and I invite a delegate from each one of these countries to meet in room 209 during the coffee break on this floor in order to review the credentials received and to report to the Directing Council without delay. Mr. Secretary, if you have any general announcements. Thank you, sir.
Interpretation is being provided in Spanish on Channel 1, English Channel 2, French Channel 3, and Portuguese Channel 4. Instructions for the use of the microphone system, together with other important information for delegates, has been distributed as a loose blue document. Most importantly, please note that if you push the black button a second time, you will annul your request on the speaker list. Delegates are asked to give their name and country each time they take the floor. Members and associate members will be recognized before. To help in the preparation of the final report, each time you speak, you will be asked to write your name and country on a speaker card and to provide the Secretariat with a copy of your written intervention if available. The Bureau is taking a series of steps towards becoming a greener institution concerned about resources and the environment. Therefore, during the Directing Council, we are delivering the documents to the delegates in the following way. During registration, the delegates were given a USB drive with all the documents in the 4 official languages so that people with laptops can have the option of viewing the documents electronically. All documents are published on our web page. Loose hard copies of the documents are available to participants upon request, and we have a document distribution center to the right of the rotunda alongside room A. The PowerPoint presentations and speeches of the special guests will be published on the website of the Directing Council as soon as they are presented. Thus, while there will be no printed copies, The material will be available in the electronic format. This evening at 7 p.m., our director, Dr. Carissa Etienne, will host a reception in the honor of the Ministers of Health and the PAHO PAHEF awardees at the Hall of the Americas in the Organization of the American States. Transportation will be provided. Vans will depart PAHO headquarters sharply at 6:45. A commemorative photo of the Directing Council participants will be taken today as soon as this meeting breaks for lunch. Gracias, señor presidente.
Thank you, Mr. Secretary. Mr. Secretary, could you please report on the exhibits and events which will take place during the course of the week?
Gracias, señor presidente.
Thank you, Mr. President.
On the side events and exhibits that we have for you that the Secretariat and colleagues have prepared. These exhibits are available on the first and second floor lobbies. In past years, we have done similar events, particularly with special sessions. For example, on the earthquake and cholera situation in Haiti and Hispaniola, and also on the challenges in responding to the H1N1 outbreak. So we believe these are very informative sessions. We encourage your participation. We're delighted to work and prepare them for you. Now I'll begin with the side events. Beginning on Tuesday, during the lunch break, we'll have a briefing session on MERS-CoV and avian influenza H7N9. The delegates will be briefed on the current situation of MERS in the Middle East and avian influenza in China. And we welcome our colleagues from WHO Geneva who will also be participating. Is there an easier way to, is it right click or left click? Okay. On Tuesday, at the end of the afternoon session, we'll also have an event on steps taken in the region to advance the social determinants of health, which was jointly organized by Argentina and Mexico. On Wednesday, during the lunch break, we'll have a briefing session on universal health coverage. This is a major priority for our director, so I encourage you all to be there. And that evening on Wednesday at 6 p.m., we'll have information on the status of neglected tropical diseases and elimination and control in Latin America and the Caribbean. Lastly, on Thursday during the lunch break, we'll have a session on the Global Fund to fight AIDS, tuberculosis, and malaria. And this will be our third session on this topic. As is customary, we also have a table outside this meeting room with technical publications. And some of these have been included in your bags, particularly such things as the copy of the basic indicators. And we encourage you to look at these data and review them with regards to your respective countries. To give you a heads up, next year we'll be continuing to support and coordinate Vaccination Week in the Americas, and as such also participate on what has become the World Immunization Week. Please note that the dates for next year are the 26th of April to the 3rd of May. The success of this initiative has been the creation, has been an inspiration for the creation of the World Immunization Week, as I mentioned, and we want to thank personally the leadership and support that Dr. Chan has given this, along with other regional directors throughout the world. Next year, the slogan for Vaccination Week will be "Vaccination Your Best Shot, Tu Mejor Jugada," and to take advantage of the upcoming World Cup in Brazil. So we encourage people to protect themselves and our region against the importation of polio, measles, and other vaccine-preventable diseases. So at the end, following the official photo of the heads of delegations, we'd also like any of you to come and participate in a second informal, more inclusive photograph using soccer balls to illustrate and celebrate the connection between two important upcoming events in our region, the World Cup in Brazil, as well as Vaccination Week in the Americas. Please note that there will be live news coverage of the 52nd Directing Council. You can follow the blog on the above link, www.paho.org/blogs/DC52. And you can also connect with us in social media through Facebook and Twitter by using the appropriate connections. The photograph of the event will also be available on Flickr. I now have the pleasure to welcome you all today to the opening of PAHO's Art for Research exhibits. These exhibits use art to communicate the idea that research for health is a worthy investment and an important driver of social and economic development. There is overwhelming evidence you're all aware of, which clearly demonstrates the critical importance of research in public health and the value added it brings to societies and economies. But here art can help us see in the larger picture by bringing life and visuals to the links between research, better health, and richer lives. Art helps us reach out to the public and to other sectors beyond health, those sectors that include financial, industry, science, technology, and education. And art also has the opportunity to provide a way for everybody to recognize the stake we all have in research for health. For example, these are images of the Panama Canal, and they remind us of the enormous impact research for health has had on economic and the political map of the Americas and the world over the past century. The canal transformed commerce, the naval industry, and geopolitics, but it could not have been built without research that facilitated the control of vector-borne diseases that for so long hampered development in our region. These images also illustrate how research for health has led to novel solutions in other key areas: kangaroo care and breast and milk banks for mothers and their babies, nutrition and child development, the control and elimination of polio, measles, rubella, and other diseases from the Americas, the transformation of HIV/AIDS from a near certain death sentence to an illness that people can live with while continually to fully enjoy life and contribute to their societies. Work on these exhibits began more than 2 years ago and has been benefited from the voluntary contributions of talented and generous artists who offered their work on a pro bono basis to PAHO to make these projects a reality. I want to especially acknowledge the documentary photographer Jane Dempster of Australia, museum photographer Theo Chalmers of the United Kingdom, and medical student and painter Shelley Mikan Che, now based in the United States. Theo Chalmers' portraits highlights champions who build on research to shape a better world. Jane Dempster's photographs show how the dynamics of research move forward. She has contributed to some more than 700 images to this exhibit. And finally, Shelley Mikian Che will join us on Wednesday for a live presentation of her unique art form, sand painting. She will show how neglected tropical diseases are being tackled through her art and the role of research for health and how it plays a core PAHO function and key component of our technical cooperation. So again, I invite you to enjoy our exhibits. Please take the time to reflect on the messages they convey and consider that investing in research for health is a smart thing to do. We are proud of being the PAHO region with a policy on research for health, which is being implemented at PAHO headquarters and in our member states, precisely because it is essential for health as well as for social and economic development. So again, I invite you to enjoy these exhibits. I'd like to thank everybody who worked on them. Thank you, Mr. President.
Thank you, Mr. Secretary. Now you'll have a chance to stretch, recharge. We'll have a 30-minute break.